Watch your weight. So now that you know that one of the factors affecting joint health is lack of physical activity, what do you do about it? Well, you naturally start off with some form of exercise to improve joint flexibility and range of motion. But at the same time, you also have to watch your weight. When your body becomes too heavy to be supported by your joints and bones, problems start to arise. As such, you need to exercise and eat right to keep your body at an optimal weight. How weight affects joints. If you have a sensation of pain when walking for a while or climbing up the stairs and are worried because it runs in the family, then you should take a look at your weight. Being overweight increases your chances of getting osteoarthritis. As mentioned earlier, this condition is caused by the wear and tear in joints and is the most common form of bone degradation. When you're overweight, there's extra stress on the joints that bears your weight. The most common of these joints is the knee joint, and it's the first one to get affected by excess weight. The second reason why weight is detrimental for joints is that as your weight increases, the inflammatory markers in the body also increase. This further causes joint deterioration in other places such as your hands and neck. The extra pounds in your body stressing your joints can lead to degeneration of cartilage and joint damage. In cases of osteoporosis, being overweight also increases the rate of bone degeneration. By shedding weight, you can protect your joints from extra stress and any further damage. Experts suggest that you should lose about 10% of your body weight and then see if the symptoms improve. If they do, then it's your weight causing the problems in the first place. Obesity further reduces any physical activity, which becomes another cause for joint issues in the long run. And if you already suffer from an extreme case of arthritis, high-endurance exercise can also damage to your joints. So, it's important to get guidance from an expert about the kind of exercises you can and should do. In osteoarthritis, sitting for extended periods of time causes stress on the joints and worsens the pain. If you have an office job, make a habit to take a walk or do short exercises after every hour. Reduce stress on joints. Weight loss is a great way to reduce stress on your joints. On average, the amount of pressure or stress on your knees is 1.5 times that of your body weight. So, if you weigh 300 pounds, you are putting 450 pounds of stress on your knees. This is when you are in standing position. As the incline increases, the stress increases too. As such, when you climb stairs, there's more stress on your knees. If your knees are extremely close to the ground, like when you tie a shoelace, the weight increases to 3 or 4 times of your body weight. Experts say that just a 10-pound increase in weight increases 30 to 40 pounds of stress on your joints. The joints work fine while they are still young and healthy, but after an extended period of time, they give up. So just imagine that if you lose weight, how much stress you'll be able to reduce on your knees. When you're young, the body's cells proliferate at a considerable rate. With age, this process slows down, so the damaged cells don't get repaired as quickly as they did during your youth. So start slow and you'll be able to lose the extra pounds very easily. Physical activity in the form of exercise is a proven way of slowing the progression of arthritis. Just like any machine, the body wears away if it is not being used properly. So, put your muscles and joints to use so that they do not rot away. Every pound you lose represents about 3,500 calories. So, if you're hoping to lose 1 pound in a week, you need to burn about 500 calories in a day. The exercise plan you follow must at least help you lose 500 calories in a day. Along with exercise, you also need to focus on your diet. Even if you're young and not arthritic, it's essential that you watch your weight to dodge this disease in a few years' time. Pay attention to your posture. It's a basic rule of thumb that good posture can save you from a lot of pain. Improper posture often becomes the cause of back pain and knee pain. Standing up straight is a good way to keep your knees, legs and back safe from stress. When you slouch, you increase the stress on your joints. As mentioned above, the closer your knees are to the ground, the more stress they bear. So when you stand, make sure there is no incline and you are straight to minimize stress on your knee joint. Whatever you do, it's important to have proper posture to keep your back muscles and knee joints safe. For example, if you are a student and you need to hold your backpack for a long time, sling it over both your shoulders rather than just one. This divides the stress instead of concentrating it only on one side. Likewise, if you carry a handbag, keep changing your arms after a few minutes. Don't sling it only on one shoulder for a long time, as that can damage the hinge joints in the region. Proper posture is essential because it also keeps your bones and joints aligned. When you have a bad posture, this alignment gets disturbed and causes the joints to rub against each other. When this keeps happening over time, wear and tear starts to take place. Your spine takes the stress and starts presenting issues. If you have a kind of job where you need to sit for many hours, make sure you have proper posture. Shoulders should be over hips and you should have good lower back support. Your computer screen should be at eye level so that you don't have to put strain on your neck to look at the screen. Keep your elbows at 90 degrees and the pens or other things you may need should be in easy reach. When you have to tie your shoelace, sit on a chair and keep your foot on the opposite knee. In this way, you won't have to bend too far down. Bending too far increases stress on your joints. So, the idea behind proper posture and exercise is not only to keep joints healthy but also to slow down the degradation process. Home remedies for easing joint pain. Oftentimes, doctors prescribe painkillers and anti-inflammatory drugs for joint pain. But if you're someone concerned about the side effects of medication, you may just wish to use some tried and true home remedies instead. Where the pain isn't too bad or too frequent, you may be able to get relief from these simple home remedies. These remedies are effective for treating joint pain in knees, neck, hips, ankles and lower back. Epsom salts. Epsom salts have been used traditionally for treating joint and muscle pains. These salts are rich in sulfates and magnesium, like many supplements used for treating joint pain. They can be administered topically as they are absorbed by the skin. These salts aid in relaxing the tensed regions of the body while keeping muscle spasms at minimum. You can simply add 2 cups of Epsom salts to your bath water and stay in it for about half an hour. Or, you can make a compress of these salts and apply to the skin topically. For doing this, add 2 cups of Epsom salts in 1 gallon of water to form a dilute mixture. Then dip a towel or face cloth in this solution and apply to the affected area. Adding essential oils to the mixture can increase the benefits of this remedy. Essential oils. Essential oils are also great home remedies for joint pain. Lavender essential oil is extremely helpful in treating those conditions in which the pain is already present and is worsening. If you take an Epsom salt bath, simply add a few drops of lavender oil to the water. If the affected area is swollen and feels warm, this could be a case of bursitis. Apply peppermint oil to the area. The cooling menthol effect of this oil will reduce the swelling and inflammation. Eucalyptus essential oil also reduces inflammation associated with arthritis and osteoarthritis. Along with that, it also helps prevent edema or fluid retention. Turmeric oils are not commonly available in many areas, but they are helpful in reducing joint pain that occurs due to osteoarthritis, rheumatoid arthritis and bursitis. You can also add more turmeric to your daily meals to get maximum benefits. Soaking the sun. You'd be surprised at how helpful a good sun bath can be in getting rid of pain. Many people with joint issues have such complaints because of lower levels of vitamin D. Your body naturally produces vitamin D when you go out in the sun. Expose your body to the sun for 20 minutes 3 to 4 times a week. Even this much exposure is enough for your body to make enough vitamin D, so whenever it's a nice day outside, take a walk by yourself or with a friend and do your joints a huge favor. Hot and cold packs. Hot and cold packs are probably the most accessible home remedy for joint pain. Both hot and cold treatments can help relieve pain and stiffness. There are 2 types of hot treatments, dry and moist. Taking long warm showers will often relieve any stiffness in the joints. Take a warm shower in the morning to feel more energetic during the day. You can also keep a heating pad on affected areas to loosen up your joints while you sleep. When heat reaches the damaged areas, it provides relief and soothes muscles along with joints. Cold treatments are great for reducing inflammation and ridding the body of pain. Apply the ice pack to affected area for quick relief. These 2 methods are lifesavers when the pain gets worse. Chamomile tea. Poultice. Chamomile tea can also reduce the pain associated with arthritis. It helps cool down the body and reduce inflammation. There are different inflammatory markers in the body that heat up the system and disturb the internal balance. This tea soothes everything and calms the immune system. To make a poultice, take 4 chamomile tea bags and add them in a cup of boiling water. Steep and keep the cup covered for about 20 minutes. Then remove the tea bags from the cup and soak a clean face cloth in the cup. When soaked with the liquid, apply to the affected area and you'll feel instant relief. Swimming. As odd as it may sound, swimming can actually help reduce the pain that comes with arthritis. It is also a good exercise for losing weight if you suffer from joint pain. High-intensity exercise is almost impossible for someone who has painful joints. Instead, exercising in water is easier as it bears less weight. Not only does swimming reduce pain, it also increases flexibility in the hip region. In addition, it strengthens the hip muscles for increased mobility. In some areas, there are special swimming classes for people who suffer from arthritis. So, look around or go for a swim occasionally. Soothing music. If you love listening to music, you can actually use your hobby to get rid of the pain. Studies show that people who listened to soothing music had reduced arthritis pain as compared to people who were not given a music prescription. Besides, music also reduces the depression that comes with joint pain. You don't necessarily have to listen to a particular genre or kind of music. The important thing is that you enjoy the music. If you like the music, your body activates several hormones that cause pain relief, acting as body's own natural painkillers. Listening to your favorite music for a bit every day can help take down the pain by several notches. Acupuncture. Acupuncture is a Chinese treatment method that is thought to be effective in treating joint pain. In this method, thin needles are inserted at specific points in the body. These are particular pressure points, and inserting needles in these points reroutes the energies in the body. At the same time, the normal balance of the body is restored. According to this treatment method, there are meridians or pathways in the body through which energy flows. A total of 350 acupuncture points are present in the body for streamlining the flow of energy. Although there is no clear scientific explanation for this method, it is thought that acupuncture induces the body's natural painkillers to set into motion. The World Health Organization recognizes this technique, and it's considered to be useful for treating more than 100 conditions. Look for a licensed acupuncturist in your region or state. You can also learn the technique so that you can do it at home anytime. All these remedies are sure to help you when you do not have medications at hand. Walking. While this isn't exactly a remedy, it's a good way of keeping pain at bay. Walking barefoot reduces the pressure on joints by 12% as compared to the stress your joints feel when you walk in shoes. When you buy shoes, make sure that they mimic the natural arch of your foot. Lifting up your heel can cause stress on your joints. So, avoid wearing heels daily, as this can cause damage to your joints. Wearing heels for extended period of time also increases the risk of joint damage. Best supplements for joint health. As you've seen previously, increased friction between joints leads to the sensation of pain and discomfort. While many resort to medication, coming up in the next chapter, as the primary solution to the problem, supplements are also a popular alternative. And while there is a plethora of supplements available, here we'll only look at some of the best in this category. These supplements have all been backed by scientific research and deemed most effective to addressing joint-related issues. Glucosamine. Glucosamine is a complex carbohydrate found in the body primarily in 3 different forms: glucosamine sulfate, glucosamine hydrochloride, and N-acetylglucosamine. Among these, glucosamine sulfate is the most common form and is extracted from the outer covering of shellfish. To treat joint issues, this supplement may be used alone or combined with chondroitin or shark cartilage for added benefits. The reason why this is considered beneficial for joint health is because it plays a vital role in the formation of cartilage. As you've already seen, cartilage thins and deteriorates with age. If anything, it needs help from supplementation to keep it healthy. Evidence suggests that glucosamine helps in slowing down this process. It assists cartilage repair and formation by incorporating sulfur into the structure. Likewise, swelling also reduces in the presence of glucosamine. People suffering from hip or knee arthritis can sufficiently benefit from this supplement. The pain-relieving effect of glucosamine lasts for about 3 months from usage, so it may not exactly offer a long-term solution. Results may take a good 6 to 8 weeks to become noticeable, but will likely be more effective than those achieved by using over-the-counter and prescription medication. Chondroitin. Chondroitin naturally occurs in the body in bone and cartilage, while supplementary chondroitin is extracted from animal cartilage. Chondroitin is present in the form of chondroitin sulfate and is often administered alongside glucosamine. Its benefits are somewhat similar to that of glucosamine. This supplement helps the cartilage retain water so that excess rubbing between bones may be prevented. At the same time, it also slows down the progression of osteoarthritis. When used on its own or in association with other supplements, chondroitin improves the shock-absorbing ability of collagen protein. Also, it inhibits the functioning of enzyme that causes cartilage breakdown. When used in conjunction with another supplement, hyaluronic acid, the two develop into a spring-like molecule. This improves the elasticity and strength of the cartilage. At the same time, chondroitin sulfate also signals the immune system to prevent cartilage breakdown by increasing collagen synthesis. Chondroitin is especially beneficial for people with hand arthritis. Although it doesn't enhance grip strength or reduce the need for pain medication, it still alleviates morning stiffness in such individuals. It can also serve as an alternative for NSAIDS for people who can't take them, as no side effects of this supplement have been reported. SAMe is a compound that's naturally formed in the body. It plays a role in synthesis, activation and degradation of hormones, drugs and different proteins. The body produces chemicals that induce inflammatory responses to activate the immune system. SAMe reduces the activity of these mediators to lower pain in joints. In osteoarthritis, proteoglycan, which is a constituent of cartilage, doesn't get produced in sufficient amounts. SAMe enhances the working of enzymes that form proteoglycan to reverse cartilage degradation. SAMe also plays a role in reducing stiffness in joints. Consequently, mobility is improved. It's been seen to be very helpful in reversing the excessive fatigue and body pain associated with fibromyalgia. Tendinitis, which refers to the inflammation of tendons in the body, is also treatable with the help of SAMe. Bursa, a cushioning sac filled with fluid between tendons and bones, can be inflamed. This leads to swelling of the bursa and joint pain. SAMe is particularly helpful in reducing swelling and tenderness. Individuals suffering from chronic lower back pain due to weight or sports injury can also benefit from this supplement. Capsaicin is a component of chili peppers. It's the constituent that causes a burning sensation in your mouth because it causes a sting when it comes in contact with any body tissue. The working of capsaicin is quite interesting as it relieves pain by affecting the nerve cells. It's used in form of a topical cream or patch. It stimulates the activation of certain nerve receptors that are involved in causing itching or stinging sensation. Capsaicin keeps the receptors activated for a long period of time. After some time, the receptor's ability to function is lost due to overreception. So, these receptors also stop processing signals for pain induction. When used on regular basis, this supplement helps numb the sensation of pain by overusing the receptors. Capsaicin is effective in relieving pain that is caused by rheumatoid arthritis, fibromyalgia and osteoarthritis. It is so effective that it can actually help lower the pain by 50% after just a month of usage. It also helps reduce pain which results from nerve damage as a result of diabetic neuropathy or HIV. Curcumin is a chemical abundantly present in turmeric. Although turmeric is only used as a flavoring agent in cooking or to give color in cosmetics, it also has benefits for joint health. Curcumin reduces pain associated with rheumatoid arthritis and osteoarthritis. When the bursa swells and causes irritation of joints, curcumin can also aid in reducing swelling and inflammation in the region for smooth cushioning and improved mobility. It blocks the enzymes that are involved in formation of inflammatory mediators in the body. One of the targets of curcumin is COX-2, a mediator that is also target of many pain-relieving medicines. So, curcumin can act as an alternative to NSAIDs. Instead of reducing joint inflammation, this supplement actually prevents further inflammation. Patients suffering from knee osteoarthritis can benefit from this supplement. In some cases of rheumatoid arthritis, curcumin actually tends to be more effective than NSAIDs. Omega-3s are naturally found in fish oils and have been consumed for centuries for their benefits. One of the main benefits of omega-3s is pain relief. The two important omega-3s for relieving pain are DHA, docosahexaenoic acid, and EPA, eicosapentaenoic acid. Omega-3s have shown most effectiveness in relieving pain due to rheumatoid arthritis. They don't reverse joint damage or play a role in synthesis of new cartilage. Instead, their only function is for pain relief. When omega-3s are taken as supplements, they get converted to resolvins in the body. These compounds are 10,000 times more effective than normal fatty acids. They inhibit the functioning of immune system mediators that cause inflammation. For inflammation to occur, the body has its own on and off switch. Omega-3s inhibit the turning on of these switches so that the inflammatory pathway cannot proceed. Hyaluronic acid is a component of synovial fluid which is present between joints and allows easy gliding of bones. In patients of rheumatoid arthritis, this component starts to break up and functioning of the fluid is affected. While its primary administration is through injections as a pain reliever, the same is also found in small doses in supplements. Research shows that low doses of this acid can reduce chronic pain and joint stiffness, though results may vary from person to person. You can take hyaluronic acid for knee osteoarthritis in the form of 50 mg tablets twice a day with meals. If your case is more severe, your doctor may recommend an injection. It incorporates into the synovial fluid and reduces friction between the bones, causing them to brush against each other swiftly. In this way, it reduces stiffness of joints and enhances mobility. Hyaluronic acid is especially used for the treatment of knee, hip and ankle arthritis, as these are the regions where joints are extremely critical. The ball and socket joint in the hips that provide maximum mobility can often be affected due to arthritis. So this supplement helps rebuild the shock-absorbing fluid present in the joints and acts like grease in bones. Hyaluronic acid injections are prescribed for patients when pain from knee arthritis can no longer be controlled by anti-inflammatory drugs and NSAIDs. Other options to treat joint pain: when your joint pain becomes bothersome to a greater extent, you can get help from some other options, including the following: medications. Analgesics or painkillers are the most common medications used for joint pain. Tylenol is a common drug which contains acetaminophen. According to many guidelines, this drug is the first line of defense against knee or hip pain associated with osteoarthritis. However, you may experience some side effects after extended use of Tylenol. Side effects of this drug include gastrointestinal bleedings, ulcers and loss of kidney functions. It is recommended to lower the dosage or lessen the treatment time. For people who are already suffering from diseases such as blood pressure, diabetes or cardiovascular diseases, the amount of acetaminophen advised for them is uncertain. This doesn't mean that they can't use the drug for treatment, it just means that they need to consult their doctors to set a dosage. NSAIDs or non-steroid anti-inflammatory drugs are also used for pain relief in arthritis. Some examples of these drugs include aspirin and ibuprofen. The problem, however, is that the likelihood of side effects is higher with NSAIDs as compared to acetaminophen. NSAIDs can also cause kidney damage and can harm the cardiovascular system. Diacerin is a slow-acting drug for reducing the damage to cartilage. This drug is prescribed to people with osteoarthritis. Although the drug is more effective than placebo, it increases the risk of diarrhea. Duloxetine is an antidepressant that is given to osteoarthritis patients. It's thought to help with chronic joint pain. It also has side effects such as dry mouth, fatigue, sweating, nausea and constipation. Topical agents. Topical treatments for relieving joint pain include gels, patches and liquid. Topical agents have different strengths depending on whether the pain is low, moderate or high. However, these are not given without prescription. It's been seen that topical agents have the same effect on pain as NSAIDs, but they have more benefits than side effects. These agents might not be suitable for everyone, but people who want to avoid oral treatments can benefit from them. Diclofenac sodium 1% gel is a topical gel that is used for treating patients of osteoarthritis. This gel is suitable for hand, wrists and elbow arthritis. The patient has to apply 2 grams of the gel on affected area 4 times in a day. It can also be used for knee or ankle arthritis, but then 4 grams of the gel have to be applied. The amount used in a day should not be over 32 grams. When you buy the gel, a dosing card accompanies it so you can measure the amount for daily usage. A diclofenac apolamine 1.3% patch is also available for pain relief. You just have to apply the patch twice a day to the painful joint. Topical treatments may also be in form of drops such as diclofenac sodium 2% liquid. To apply this, you have to put 40 drops on each knee 4 times in a day, as it is best for knee arthritis. Other than these topical treatments, NSAIDs such as ibuprofen can also be made into topical solutions. Topical agents are best for joints that are closer to the surface. So, they'll help relieve pain that comes with hand, elbows and ankle arthritis. Those who can't take oral medication because they are diabetic or have heart problems can use topical agents instead. Likewise, people who have a history of gastrointestinal problems or ulcers should opt for topical agents rather than oral NSAIDs. Injections are the middle ground between surgery and oral medication. If oral NSAIDs don't work for you and you're not yet ready for surgery, then injections are your fix. Hyaluronic acid injections are given for knee arthritis to supplement the natural hyaluronic acid present in the joints. When injected into a joint, it helps reduce pain and inflammation. These injections are given 3 to 5 times a week. The doctor would first insert an empty syringe into the knee to remove fluid from the knee to make room for hyaluronic acid. Then, hyaluronic acid supplement is injected into the emptied area. Corticosteroid injections are also given for reducing pain and inflammation. These injections are also given directly and are most suitable for knee osteoarthritis. The benefit of these injections can last for a few weeks or even 6 months. Although these injections don't have as many side effects as oral medications, it doesn't mean that they have no risks associated with them. Doctors normally limit the number of injections you get since excessive use of these injections can actually contribute to cartilage breakdown. Arthrocentesis is a process in which a hollow needle is inserted into the joint and the joint fluid is removed. Oftentimes, this fluid is removed so that it can be tested in labs, but when excess fluid is removed, pain and inflammation is also sufficiently reduced. Sometimes, doctors can insert corticosteroid injections into the same place from where the joint fluid was removed. Physical therapy is a great tool for reducing stiffness that comes with joint pain. Occupational therapists can train patients to move their affected joints without increasing any pain. Also, they help patients change their homes to adapt to their needs. With physical therapy, stress on joints is reduced. Sometimes, splints or other devices are also suggested to help the patient in daily tasks like dressing and driving. The aim of physical therapy is to ensure that you can perform daily chores without any difficulty. Your therapist would try to increase the range of motion and build strength in the areas around joints. This increases flexibility and motion. A physical therapist teaches you how to do simple chores in a way that least stress is put on joints and stiffness is reduced. Since every patient is different, a therapist would devise a personalized exercise plan for you. It'll teach you how to maintain proper posture and use assistive devices such as canes or splints. A physical therapist would also tell you how to properly use a heat or cold treatment method and bring some ergonomic changes to your house. For example, a therapist might suggest you to use cushioned mats or get special chairs. After frequent visits to a physical therapist, you'll be able to do things like reach your kitchen cabinets, bend down to tie your shoelace and take a morning walk. Over time, if you consistently do the exercises, your body will get adept at the routine and get stronger. You can get recommendations from your doctor about a therapist, or you can find one in your area who specializes in arthritis patients. Remember that you have to combine the treatment methods to get the best results, rather than just relying on any single one. Conclusion: while exercise and diet remain the fundamentals for good joint health, you can also include things like supplements and physical or aquatic therapy to enhance your joint health. Preventing joint pain can be a lot easier than having to deal with the distress of joint inflammation and susceptibility to disease. Let your joints thank you for taking good care of them.